Hey guys, Dr. Davin, board certified dermatologist. Today I'll be talking about skin scars or acne scars, how to treat, or how most dermatologists manage acne scarring, especially in darker skin types. Now, why darker skin types? There's a few things. First of all, the biology of skin is very different. How patients with darker skin, they react very differently compared to someone who's Caucasian, basically type 1, type 2 skin, or fairer skin, right? That's the first thing. And then the second thing is the amount of scarring. So the scar patterns in patients who are of different ethnicities may be different. So the first thing as well is biology of skin. Why is it super important that we understand skin type? It's because of this. In patients with darker skin, any devices, and whether it be energy devices, chemical peels, or even things like surgical procedures, the skin can produce more pigment. The reason being is that we still have the same amount of pigment cells called melanocytes, but there's increased amount of pigment called melanin. So the melanocytes are the pigment producing cells. Once again, they're the same number compared to someone with fairer skin. But generally speaking, they're more active, which means when you get a mosquito bite, acne lesion, post-inflammatory hyperpigmentation, any trauma to the skin, we term brown, and that's just mozzie bites. Yeah, that's just from mosquito bites, and that was about 6 weeks ago. So the darker you are, the more pigment it produces. That has bearings on two things. First of all, PIH, which is post-inflammatory hyperpigmentation from the acne lesions itself, so that's considered grade 1 scarring. And the second is that anytime, like I said, anytime you use anything basically, whether it be microneedling, a TCA cross, TCA paint, TCA peel, whether you're using lasers or radiofrequency microneedling, or even surgical methods, whether it be punch grafting or punch excision or even subcision, you have a much higher chance of causing skin color changes. So that's very important. And the other thing as well, the third thing, is that our biology for our fibroblasts, which are the cells which produce collagen, in other words, the cells which actually repair your scars, can go the other way around. So we have what's known as hyperactive fibroblasts, or your fibroblast response is exaggerated. So that's why the darker skin you have, the more you're prone towards certain types of scarring. For example, hypertrophic scars, keloid scars. Now, when you look at skin of color, right? So whether you're Asian like myself, or whether it be Hispanic or Mediterranean or African American, we scar a little bit different. So our scar patterns are a little bit different. We have more hypertrophic scars, so scars which are actually raised. And the common pattern is basically, in Asians especially, you have these what's known as, well, I call them hypertrophic pebblestone scarring, or hypertrophic fibrotic pebblestone scars. And they often occur around the nose area and around the chin. So they're very hard scars, and they're basically areas of fibrosis. In other words, your body's kicking up too much abnormal collagen, secondary to inflammation, which is caused by your acne. So with hypertrophic scars, the treatment of choice basically is to reduce the actual height, because scars can only be one of two things. It can either be a color change or a contour change. If you improve the color, whether it be red or brown, if you normalize it, and if you decrease the contour change, and the contour can be higher or lower for atrophic scars, you don't have a scar anymore. So scar revision, basically the concept is very, very easy to understand. Normalize the color, normalize the contour, you don't have a scar. So how do we actually decrease hypertrophic scars? Well, you can use many things, but the most reliable that dermatologists use are simple things called intralesional corticosteroids. So basically we use a needle, we inject the scar with a very dilute solution of steroids. Generally speaking, you need, depending on how big the scar is, but for things like on the nose, you may only need 2 to 4 treatments. But for example, if you have really, really thick hypertrophic and keloid scarring, you may need a few more treatments. So anywhere up to 6 to 12 treatments over somewhere like a year. So unfortunately, there's no quick way to treat hypertrophic scars. Yes, I'm well aware of microneedling together with drip steroid. I'm well aware of things like 5-fluorouracil, which I use, 5-FU. And also for the recalcitrant cases, or the cases which are really tough, I do use sensible fractional CO2 laser as well. But I'm just keeping things basic, so that's how we treat hypertrophic scars. Now, the other scar types are basically atrophic scars. So atrophic scars, they can be classed in regards to various scar types. How I like to put things, you can have scars which are superficial. So we talk about things like boxcar scars, pick scars, icepickscars. And then you can have scars which are deeper. So that's what I call rolling scars, tethered scars, severely atrophic scars. It is very unusual to have a patient with one type of scars, what I call monomorphic scarring. So most of us will have different types of scars. So usually you have a mixture of boxcar scars, pick scars, icepickscars, rolling scars, fibrotic scars. So all of these scars have different implications because they all have a particular treatment. So remember, guys, in the context of bespoke scar remodeling or scar treatments, it's not about the device. I'm so, I guess, over the fact that everyone else goes, hey, is Morpheus 8 a good treatment? Is Genius RF a good treatment? Is Infinity a good treatment? Is whatever a good treatment? The answer is that it really depends. Now, most of the scar treatments that I do, and including not just me, but including many dermatologists and plastic surgeons, we use our hands. So we don't actually we use instruments as tools, like a can opener, yeah? So, I mean, if you've got a can opener, everything you look at is going to be a can, right? So if you've got a microneedling device, everything you're going to look at, you're going to microneedle. Do you get the drift? It's not good to just go around to practice with a can opener or a microneedling device or a laser. You do need different tools in order to treat different problems. The same goes for acne scarring. You do need many different things. Everything's from lasers to scalpels, to peels, to microneedling devices, to radiofrequency devices. These are all needed because each scar type will have an optimal treatment. So we talked about hypertrophic scars. Atrophic scars, I'll go through things very quickly. If you have superficial scars, they're much easier to treat compared to something like rolling scars or rolling tethered and highly atrophic scars. So superficial scars, boxcar scarring and pick scarring. These are actually on the surface. This is where things like, for example, if someone is really, they're not trained to actually do surgical procedures, nor are they trained to do manual work. Certainly the use of things like fractional laser resurfacing, whether it be your non-ablative lasers like Fraxel, which doesn't work very well, by the way, and things like CO2 lasers or fractional erbium lasers or a whole heap of other non-ablative wavelengths. When you actually treat superficial scars, they can respond. The flip side is that for darker skin patients, the darker you are, the more treatments you have. I'll tell you why. It's because if you try to actually go too high with the energy or the density or the amount of passes that you have with these energy devices, guess what? Your skin kicks back and you're going to have darkness or dark skin or what's known as post-inflammatory hyperpigmentation for a more prolonged period. So most dermatologists and plastic surgeons were more conservative when we're treating darker skin type. Some of us would even do a patch test. So for example, if I see someone who's skin type 5, skin type 6, African American, I would not hit them with a big laser parameter to begin with. I get to understand their skin first. So what I might do is a conservative treatment for the first treatment and then slowly increase it from the second or third. The problem being with darker skin types is not the post-inflammatory hyperpigmentation, because if you're dark skin, if you want any meaningful, so this is very important, guys, this concept is really important. Now, if you want a meaningful result from a treatment, you've got to trade your scars, basically your acne scars, for temporary, and once again, this is the word is temporary hyperpigmentation. The temporary hyperpigmentation, in other words, skin that goes darker, may last anywhere from 2 weeks all the way to 2 months. So basically, it's a trade. If we try to do things a little bit slower, we may get there, but instead of taking, let's say, 3 or 5 treatments, it might take you 12 to 16 treatments. So a good dermatologist and plastic surgeon will actually tell you, look, we're going to treat you. You may have some skin color changes. Everything will be all right. Where it can go really wrong is that if you try to go big parameters early with too high density, too high passes, and too much energy, you can go the other way around. Instead of being brown or hyperpigmented, you can go white, which is hypopigmented. And that, my friend, is a very hard thing to treat. So most of us are pretty conservative, and slowly we increase the power and we increase the settings as time goes by, because we need to understand not only your skin type, but how you respond to a particular treatment. So we talk about superficial scars, many treatments out there, everything from lasers to simple microneedling, simple derma rollers or microneedling or even microneedling RF. They can all work. Now, it's not, when we treat scars, it's not what works, it's what's actually best for that scar type. So for example, boxcar scarring, to minimize collateral damage, most of the time I'm using TCA. So it's a manual method. It's not a lazy ass way of taking a laser and just waving it around, taking a microneedling pen and just microneedle the whole area. We're treating each scar manually, so by hand, one at a time, with either a toothpick, a syringe, or in my case, a paintbrush. So if you got 200 scars on one cheek, I treat 200 scars on one cheek. The skin in between your scars, I try not to treat. That way you're minimizing collateral damage. So it's much like going to war. You're not going to carpet bomb with a B-52 and just bomb the whole area. You want to use what's known as a smart bomb. So a smart bomb is a very precision instrument. And basically you just want to deliver that bomb, or in this situation, a TCA, to that TCA application to that particular scar type. You want to minimize collateral damage in between the actual scars because there's no scar there, so why treat the skin? So look, that's a manual way of doing things. It's time consuming for the patient, it's time consuming for the plastic surgeon, the dermatologist, but that is the gold standard. So if you have these types of scars, you should be treated with minimal collateral damage. From there, from the TCA, in the context of that scarring, guys, so I'm not talking about rolling scars, we're talking about monomorphic or mixed scarring with that kind of pattern. From there, you can use other things, for example, certain lasers. And like I said, many lasers, there are many doors to the same destination. So if one of my CO2 lasers are down for a particular reason, I may use an erbium laser. And if you know your parameters well, within the actual devices itself, you may be able to compensate for example, from a less powerful laser by doing more passes. So once again, guys, you got to understand, it's not about the equipment, right? It's not about the equipment. It's not about laser. It's not about that at all. It's about using the parameters which you've got, or the instruments which you have, adapting that to the patient. So once again, if I do have a device which is, for example, I'll give you an example. For example, microneedling. Yeah, so I've used quite a fair few. Intensive, the RFmicroneedling from Secret, the Genius, and Infinity, and whole Intracell, and a whole heap of others. So if one of my devices are down, for example, if my Genius RF is down, and I've got access to, for example, an intensive, I know, or a Vivace, yeah, I know I can actually get pretty close to the settings of what another RF device can. But I've got to use that device which I've in my hands, which may be not as good, nor as powerful, nor have insulation compared to the something like Infinity or Genius. But most of us can use a device and go what's known as off-label. So we go a lot higher passes and a lot, for example, a lot denser. So instead of actually doing 2 passes, we may be doing 4 passes, but we know the device to compensate for the lack of power, or in that situation, lack of insulation. So guys, it may give you a result which is slightly inferior compared to a better device, but it shouldn't be chalk and cheese. So it might be something like a 10 or even 20% decrease compared to something like a good device. So guys, once again, it's not about the device, guys. It's about how to use those parameters sensibly. There's certain exceptions that occur. For example, if I've got a very weak CO2 laser, I may not be able to actually get to the depth which I want. In that situation, I may have to compensate by using manual methods, whether it be overpass with microneedling or dermal rolling, or doing more subcision, or for example converting a TCA from a 100% to something like a global 20%. But once again, that's in the context of your skin color. So we talk about superficial scars. That, I say, is very easy to treat, because that can be delivered by protocol, and usually in a few treatments patients will improve. So the harder scars are the ones which are rolling scars. So rolling scars, basically, if you think about your skin in two layers, yeah, your dermis, right, which is the upper part of your skin, you've got epidermis, dermis, and then fat. The rolling scars, generally speaking, have attachments, yeah. So this is something that really important to understand. If you get scars which on angle lighting you can see that are depressed, Generally speaking, they have attachments from the dermal layer, which is your middle of your skin layer, down to the fat layer, and then some cases from the fat layer all the way down to your muscle layer and to your deeper structures. So it's very important for those. You need a procedure to release those bands, and subcision is by far the best procedure. So subcision can be classed as a surgical procedure that we perform under local anesthesia, in other words, numbing injections. I do a lot of my subcision with sedation, so that way patients are nice and quiet and they're relaxed and they don't have any pain. That way I can work quicker, more efficiently, and most importantly, patients are actually very comfortable with the procedure. So that procedure is performed by plastic surgeons and dermatologists. And what we do is we release the actual bonds which hold down the scars. Now, in darker skinned individuals, we have to be very careful still, because if we do cause what's known as a bleed or a hemorrhage, that can actually turn into brown skin. In other words, hyperpigmentation. So it's extremely important when we're doing the procedure, we evacuate any blood clots and compress the area. So in most of the cases of acne scarring, whether it be type 1 skin, fair skin, or darker skin, the gold standard is to combine the many, many different methods. Once again, it's not about the device, guys. It's about the method. So combine many methods based upon your skin type, your scar type, and your downtime. So in theory, there's only 3 variables, yeah? Certainly, look, the 4th variable I'll be talking about obviously is expense, because at the end of the day, not everyone can afford to see a dermatologist or a plastic surgeon. So then I'll give you a couple of hints what you can do at home. So those 3 variables, when you see a specialist, those are the ones we actually input in into our thought processes, and we come out with a revision program based upon your skin type. How many treatments you say? Well, it depends. It may take anywhere between 2 treatments all the way up to 6 or 7, sometimes even 8 treatments, depending on the extent of your scars. So before I go into DIY treatments, I'm just going to talk about fillers, yeah? Now, people go, look, every day I get the same thing. Guys, I want Davin, I want a permanent result. Everyone wants a permanent result. Most plastics and derms, we want to actually treat your scars. We want to give you a good result, and believe it or not, we don't want to see you again, because the whole idea is not to bring you back every year for treatments. We want to give you a good outcome with as few treatments as possible. Now, all the treatments we do, everything we do, whether it be laser, peels, whether we do subcision, any of those, apart from the fact that sometimes when we cut out the actual scar, so whether we do a punch excision or whether it be a surgical elliptical excision with direct closure, except for that, we rely on your body's immune system. So this is very important. Your immune system to revise the scar, in other words, remodel the scar, and then your fibroblasts, which are your collagen producing cells, to produce collagen. Now, some people can do that very efficiently, and you do one procedure and you expect to do 3 or 4, they come back and you just go, whoa, 90% of your scars are gone. If you apply the same procedures across the entire board, it's not the procedure, right? It's not the procedure, because that's standardized. It's not the equipment, because you're using the same parameters and using the same equipment. What is different is basically your immune response. Now, that is very important to understand, because some patients who can remodel scars very easily, they don't require fillers. But for those who may be challenged with that, so they may be a little bit older, they may be smoking, they may be actually very fit and healthy, but for some rhyme or reason, they can't actually repair as much collagen or regenerate as much fat. And for those, they may need a helping hand. That's where fillers come in. So that's a whole new lecture, guys, but that's just something for you guys to think about. Now, the 4th thing which I alluded was basically the expense of treatments. So we're not here to go, well, let's find the cheapest, I guess, procedure. But this whole lecture is not aimed at, at that. It's to actually give you an insight as to how dermatologists and plastics think in the context of your scarring. Now, when it comes to DIY treatments, what can you safely do at home? I think if you've got dark skin type and if you're very good with your sun protection, and we're not talking about PIH scars, because that's a whole new topic. I've covered that in the past, by the way, so check it out. But we're talking about scars which are atrophic, so scars which have little divots. For that, if you guys want a cost-effective procedure or cost-effective way of DIY at home, here's my hint. you probably want to use something like a retinoid rather than a retinol. So in the US, you can get some adapalene, which is different. Try to get some of that. Try to use that, 5 to 6 nights per week. That can actually help remodel early scars, especially associated with acne. It can help with some of the pigment as well. So that's the first thing, a good topical. Second is a good sunscreen. Third, if you want to try stuff at home, you can get yourself those derma rollers, which are super cheap on eBay or Amazon. Do not try to exceed 0.2 mil. Don't go for hero settings. In fact, even in my practice, when I actually derma roll or microneedle, it's extremely rare I go past 0.7, 0.6, 0.7 mil. I never use anything longer than the 1 mil. The reason being is that most of your scars don't go beyond that depth. The whole idea with microneedling, believe it or not, is not to go really deep. It's to actually, number one, increase your topicals, in other words, absorption of your creams. And number two, some remodeling of your scars through partial and controlled damage of your epidermis. So that's very important to understand. It's not about the depth, guys, when you're doing microneedling. It's not about the depth. It's about doing safe parameters. Just by stretching your skin, right, causing some traction, counter traction, and by rolling in an appropriate manner together with pressure, even for something like 0.2, you will get profuse bleeding. So if you have a look at the link below, you'll see a couple of my videos where I'm doing 0.2 mils, guys, 0.2 mils, and I'm getting blood everywhere. So if you actually put the enough pressure with counter traction, you can get the job done safely, efficiently, at something like 0.2 mils. Guys, I hope you liked that video. It's a very quick one. Well, it's not really, it's about 20 minutes, but I can go on for another 40 minutes or so. Guys, I hope you liked that video. Please like, comment, share, subscribe, and I'll see you next week. Bye for now.